Hi everyone, I am Jan Alfon Francisco, and I will be discussing our research entitled Anticancer Properties of BC Truncated Deguelin Derivatives. For its background, Deguelin, a naturally occurring rotenoid generally used as pesticide and fish poison, has gained research interest due to its potential anti-cancer activity, but its clinical application has been impeded due to its Parkinson-like symptoms observed in rats. Due to this, researchers have explored various structural modification as practical approach on improving the drug's pharmacological profile. For the past years, Deguelin was subjected to numerous structural modification to understand its structure-activity relationship in search of effective yet non-toxic anti-cancer drug. Below are some of their findings. Removal of these methoxy groups lowers the anti-cancer property of the degaline, making this an essential group of the compound. Conversion of the carbonyl group to alcohol and oxime derivatives poses significant improvements on its property. Reduction of this alkene group to alkane poses no significant effect on degaline, making it a non-essential moiety. Lastly, truncation of the BC ring shows equipotent bioactivity to degaline, indicating that this is also a non-essential group. These findings were then used as basis for looking for potential anti-cancer drug derivatives of degaline. The following methodologies were then conducted on this research. Compounds were initially designed and synthesized by either tweaking the carbonyl groups to form oxime and alcohol derivatives or by synthesizing alkylated products. These compounds were then purified and characterized using various spectroscopic techniques such as NMR spectroscopy, IR spectroscopy, and mass spectrometry. Afterwards, compounds were then tested for their anticancer properties against three cancer cell lines such as A549 or lung cancer cells, HCT116 or colorectal cancer cells, and MCF7 or breast cancer cells. Compounds observed to have anti-proliferative activity on at least one of these cancer cell lines were then subjected to toxicity assay to assess its activity against normal cell lines such as H9C2 or normal heart cells, HepG2 or liver cancer cells, and HK2 or normal kidney cells. For the results and discussion, the design compounds for this research have the following alteration on its structure: carbonyl group formation, alcohol and oxime derivatives preparation, and formation of different O-alkyl oxime derivatives. Erie modification were done by attaching alkyl groups with different lengths and cyclization. This table shows the summary of the synthesized derivatives together with their reaction yields and characterization data. Compounds 1, 3, 3A, and 6 were submitted to the mammalian cell culture laboratory of the Institute of Biology for the evaluation of its anti-cancer property against three cancer cell lines. This table here shows its summary with doxorubicin, a known anti-cancer drug, as the positive control. Compounds 1 and 3 were found active against lung cancer cells with comparative efficacy with doxorubicin. On the other hand, only compound 3 was observed to be active against colorectal cancer cell lines, while none of the submitted compounds were active to MCF7. These two compounds then were submitted to Disease Molecular Biology and Epigenetics Laboratory of NIMBB for the assessment of their toxicity profile. It was observed that both compounds were safe to all cell lines, indicating that these compounds were non-toxic. With all this data, the following conclusions and recommendations were made. A total of 12 structurally simpler derivatives of degaline were successfully synthesized and characterized with satisfactory reaction yields. Anti-cancer assays revealed that compounds 1 and 3 displayed acceptable anti-proliferative efficacy on a panel of human cancer cell lines. These compounds were also found to be non-toxic, indicating that degaline truncation and further structural modification have evident effect on its bioactivity. The study then recommends additional investigations such as admetox assays and in vivo testing to further support these potential effective and safe anti-tumor agents. This research would like to acknowledge the following institutions for their assistance on this research. Thank you very much for listening and have a great day.